is the best way to have beautiful skin. Here to talk about the trend of prejuvenation are Megan Wilkinson and Danielle Howell. They're with Medical Aesthetics Regenerative Center. Good morning to both of you ladies. Thank you so much for being here today.
Good morning. Thank you for having us.
Okay, let's talk about this term prejuvenation. Kind of what does that mean?
So many people are familiar with preventative health care when it comes to medicine. Go to your doctor every year, get a physical, have your annual cancer screenings. So we're just taking that concept and applying it to aesthetics. If we do some things when we're younger, we can look better when we're older.
That's true. It kind of staves off the aging process a little bit.
Exactly.
You say it really does start with good skin care. How do you help your clients get on the right regimen for them?
So when we first see our clients, we talk about the importance, skincare starts with what we put in our body. So, people that have diets high in sugar, alcohol, dairy products tend to have more skin issues. So it really starts with eating healthy, drinking lots of water, good sleep at night, and good exercise. 3 treatment skincare options that we recommend to start at an early age in our 20s and 30s, which is when the first signs of aging start, include number 1, a retinol. It's very important to help stimulate collagen. The second one is an antioxidant, which helps counteract the environmental stressors that we have, smoke and pollution. And the third one is a good moisturizer, which is also very important to use on a daily basis.
And again, these are all things that anyone at any age can use. The younger you start, the better. But even if you're, if you're more mature, you can still incorporate these into your skincare, correct?
Most definitely.
Absolutely.
Okay.
Absolutely.
Let's talk about SPF. How important is it to wear SPF even in the winter months and make sure you have a good quality product?
So SPF is extremely important. We can't stress it enough. So the sun is the #1 cause of aging. So fine lines and wrinkles, sunspots, those brown spots that everybody talks about, and also collagen loss. So, and SPF comes in a wide variety of products. So we can do creams, tinted moisturizers, powders. It's just very, very important to use it on a daily basis, at least an SPF of 30 at the minimum.
Yes, and if people come in and see you too, you can help make sure they're using what's right for their skin type.
Absolutely. We have a variety of skin products for anybody here at Mark.
Okay, so let's talk about other things we can do for prejuvenation. You suggest smaller doses of Botox. Talk about how that helps ward off wrinkles.
Yeah, so neuromodulators, which are commonly known as Botox, what they do is they relax the muscles of facial expression. So when we raise our eyebrows or furrow our brow, we see those lines. Well, as we get older, if we don't treat them, those lines can set in and they can become what we call static lines, or we see them on our face all the time.
So even when your face is in repose, you can still see the deep lines.
You can see the deep lines. So if we start in our mid-20s to early 30s, by treating those, we can prevent those lines not only from being present at that age, but from getting set in and staying deep.
Right. Oh, that's a good idea. And again, it just takes a small amount because at that age you don't have a lot of wrinkles. Just a little bit, it'll
goes a long way.
Yeah, it's good. How can filler help keep your skin in good shape?
Yeah, so as we age, our face typically loses volume. So we'll see it in the cheeks or in our jawline, and that can create some sagging and some deep wrinkles. And that usually starts in our 30s. So if we use filler to replenish that volume, we can lessen those wrinkles, and it also has the added benefit of stimulating your own collagen for long-term results.
Which is what we want. And they do all of this at Mark right there in their office. I've been there. It's a lovely office. You all do such a wonderful job.
Thank you.
Thank you so much for being here today.
Thank you.
Merry Christmas to you.
Merry Christmas.